10 symptoms you have a potassium deficiency. Do you ever wonder what might happen if your body doesn't get enough of a crucial mineral, potassium? Well, the worst case scenario is a cardiac arrest. Potassium, or the lack of it, a condition called hypokalemia, can lead to serious issues. Why? Because potassium plays an important role in muscle control, fluid balance, nerve signaling, and blood pressure regulation. Now, what might make you susceptible to a potassium deficiency? Certain medical conditions like kidney problems, bouts of diarrhea, or vomiting can put you at risk. Even some medications, like diuretics and laxatives, can disrupt your potassium balance. But here's the exciting part. We're about to reveal the 10 symptoms that you have a potassium deficiency. Stick around till the end, because we've also got a list of foods that can help boost your potassium levels. Curious? Let's find out together. Just a heads up, this video is for informational purposes only. If you feel unwell, please talk to your doctor. Number 1. Constipation. Potassium is a crucial element that has a significant role in regulating muscle movements, even in the muscles of our intestines. When potassium levels are low, it can impact these intestinal muscles, causing food and waste to move slowly and leading to constipation. In the walls of our colon, potassium is necessary to ensure smooth peristaltic motion. Without enough potassium, the colon walls become weak and can't contract as they should when it's time to move fecal matter. Potassium in the colon wall tissues bring in more oxygen, which is essential for proper cell function and the removal of toxins. When there's an excess buildup of fecal matter and toxins on the colon walls, it can result in persistent constipation. This buildup interferes with the normal functioning of the colon walls. Consequently, constipation can be a potential symptom of potassium deficiency. Number 2. Dry skin. Potassium also plays a crucial role in balancing fluids within our body, including the skin. When you don't have enough potassium, it can lead to dry skin, which can result in skin issues like acne. Potassium helps control how much water our cells hold, which keeps our skin nicely moist and hydrated. If your skin becomes extremely dry, it might be a sign of not having enough potassium, and you shouldn't ignore it. To make sure your skin stays hydrated and healthy, consider eating foods that are rich in potassium. Foods like avocados, bananas, spinach, white beans, watermelon, and sweet potatoes can help maintain the right amount of water in your body, which protects your skin and hair from getting too dry. Dehydration, which can lead to dry skin, headaches, reduced urine output, fatigue, sleepiness, dry mouth, and increased thirst, can be prevented by having enough potassium. While potassium can't be absorbed through the skin, some companies have developed products like bath soaps, fragrances, and cosmetics that contain potassium compounds. These products are designed to enhance the skin's pH balance and moisture levels, keeping it well hydrated and fresh feeling. Number 3. Frequent urination. The kidneys have an important job in our body. They get rid of waste toxins and make sure the right amount of fluids and minerals like sodium and potassium are in our blood. They do this by sending waste and extra materials out of our bodies when we pee. Now, if there's a serious deficiency of potassium, it can mess up the kidneys' work in keeping the right balance of fluids and minerals in the blood. This can cause more peeing, which we call polyuria. Found these tips helpful? If you do, please like and subscribe. You'll be the first to hear about more content like this. Thanks for learning with us. Number 4. Mood swings. Potassium has a significant role in managing muscle and nerve activity, including those in the brain. When potassium levels are low, it can affect the brain's proper functioning, potentially causing shifts in mood, irritability, and even depression. Potassium's job includes maintaining the right balance of fluids in the body, which is crucial for proper brain operation. If potassium is lacking, it can disrupt the signaling to the brain, resulting in mental fatigue and mood fluctuations. Moreover, potassium plays a key part in generating neurotransmitters, which are chemicals that convey messages between nerve cells. Inadequate potassium levels can hinder the production of these neurotransmitters, contributing to mood changes and other emotional symptoms. But take note, it's essential to recognize that mood swings can arise from various factors, and potassium deficiency is just one potential contributor. Number 5. Loss of appetite. Hypokalemia, which means having low levels of potassium in the blood, can bring about various symptoms. These include the loss of appetite and other digestive problems like nausea and vomiting. Hypokalemia can affect the hormones that control appetite and digestion. For instance, low potassium levels can make the hormone aldosterone go up, and that can result in a lower appetite and trouble with regular bowel movements. Additionally, potassium is crucial for muscles to contract properly. When potassium levels are low, the muscles in the stomach and intestines may not work as effectively. This can lead to a delay in emptying the stomach, causing feelings of nausea and vomiting. Number 6. Muscle aches and stiffness. If you often suffer from muscle strains, pains, and tightness, it might be due to a potassium deficiency. These muscle discomforts could signal swift muscle breakdown, a condition known as rhabdomyolysis. This condition results from insufficient blood circulation and oxygen supply to your muscles. Also, the levels of potassium in your bloodstream play a crucial role in controlling blood circulation to your muscles. When potassium levels are low, it can restrict blood flow to your muscles. This limitation in blood flow deprives your muscles of the necessary oxygen, leading to the rupture and leakage of muscle cells, which ultimately result in rapid muscle degeneration. This is the root cause of muscle pains and stiffness. Number 7. Unexplained fatigue. Fatigue and weakness can be some of the initial indications that you lack enough potassium, and there are a few reasons for this. First, potassium plays a role in controlling your muscles. When the amount of potassium in your blood is low, your muscles may contract less powerfully. Additionally, not having enough of this mineral might influence how your body utilizes nutrients, potentially causing fatigue. For instance, some research suggests that a potassium deficiency could hinder the production of insulin. This can lead to elevated blood sugar levels and reduced glucose, which serves as a source of energy for your cells. Number 8. Tingly or numbness. Although more common in individuals with high levels of potassium, those who lack potassium may also endure ongoing sensations of tingling and numbness, a condition referred to as paresthesia. Typically, this sensation is felt in the hands, arms, legs, and feet. Potassium plays a vital role in ensuring the proper function of our nerves. Thus, when blood levels of potassium are low, it can lead to a weakening of nerve signals, resulting in tingling and numbness. While occasionally feeling these symptoms is generally harmless, such as when your foot falls asleep due to inactivity or an uncomfortable position, persistent tingling and numbness might indicate an underlying health issue. If you encounter these persistent sensations, it is advisable to consult a medical professional. Number 9. High blood pressure. Maintaining a proper balance of electrolytes is crucial for keeping your blood pressure in good shape. You might already be aware that consuming excessive sodium can raise blood pressure in certain individuals. However, not many people realize that insufficient potassium in your diet can have the same effect. Potassium plays a role in helping your kidneys remove excess sodium from your body through urine. If there's not enough potassium in your bloodstream, your kidneys reabsorb sodium into your blood, potentially causing high blood pressure over time. This typically happens when your diet lacks enough potassium. Therefore, making sure you get an adequate amount of potassium in your diet could be a way to help maintain healthy blood pressure in some people. Number 10. Irregular heart rhythms. An additional sign of severe potassium deficiency is an abnormal heartbeat pattern. Potassium is crucial for controlling muscle contractions, including those of the heart. When the body has very little potassium, it can cause irregular heartbeats. These can include sinus bradycardia, ventricular tachycardia, and ventricular fibrillation. If someone doesn't get treated for these issues, they can become very dangerous. Doctors can identify these irregular heartbeats by using a test called an electrocardiogram. Thank you for making it this far. So now that we know the symptoms of potassium deficiency, the question now is, how to address low potassium levels? The approach to addressing low potassium levels depends on how serious the deficiency is and your medical background. For mild cases of low potassium known as hypokalemia, your healthcare provider might recommend stopping any medications that can reduce potassium levels, using potassium supplements, increasing your intake of foods naturally rich in potassium, using medications designed to boost potassium levels in the body. Nevertheless, it's important to be cautious because taking too much potassium can lead to a condition called hyperkalemia, which can result in significant damage to the muscles and heart. What to eat when you have low potassium levels? To keep your potassium levels in check, it's important to know that adult males should aim for 3,400 milligrams of potassium daily, while adult females should target 2,600 milligrams. If your doctor has diagnosed you with hypokalemia or low potassium levels, make sure to include these foods in your diet: lentils, oranges, bananas, dried apricots, low-fat milk, spinach and broccoli, brown rice, yogurt. Maintaining a well-balanced and healthy diet is the most effective way to ensure your body gets the potassium it needs. It's a good idea to consult with your healthcare provider and consider keeping a food diary if you're dealing with potassium deficiency. Potassium is a crucial mineral for our bodies. Potassium deficiency can lead to serious medical conditions that may pose a risk to your health. Typically, potassium deficiency arises from losses in potassium through the digestive tract or the kidneys. A combination of a balanced diet and prescribed medications can help manage potassium deficiency. If you found this video useful, please like and subscribe to our channel for more informative content. To find more info and links about today's video, make sure to look at the description below. Thanks for watching.